Good afternoon, everyone. I'm Kevin Gletz, and I'm an industry education coordinator working with the Regina District Industry Education Council and SunWest School Division. Today it's my pleasure to introduce Cam Fuglerud, who is an orthopedic medical sales rep working for Zimmer Biomet. That's quite a mouthful. Cam's going to tell us what that all means, and I'm sure that you'll be intrigued as I was when I first met Cam and heard what his occupation was about. So he's going to describe the work he does and the education path he took to get to this position. So just a reminder before we begin, this session is being recorded and will appear on the RDIEC YouTube channel for you or others to view in the future. We'd like you to request that any students who watch this session go to our website at www.rdiec.ca and complete the student survey that can be found near the top of the website's home page. Completion of the survey gets your name in a monthly draw for a $50 gift card. Again, the website is www.rdiec.ca. And if you have any questions, ask them at the end of the presentation. Once again, welcome, Cam, and I'll turn it over to you.
Awesome. Thanks, Kevin. Yeah, as he said, my name is Cameron Fuglerud, orthopedic sales rep for almost 10 years now. And I'm actually based in Lethbridge, Alberta. And I cover Lethbridge, Medicine Hat, Whitehorse, and a couple of the smaller rural hospitals in between. But usually orthopedic surgeries happen at bigger centers, and we'll kind of move on and you'll understand why. So moving on. So what is medical sales? First of all, sales, it was a hard stigma for me to overcome myself. But sales is really a necessary job for any business. If you have a big company and you have these awesome products or services, how are you going to get that information out? Salesman, right? And not everyone is a greasy car salesman, as you guys hope to come to learn. I'm very proud of what I do, but when I talk about sales, really it's me just showing new technology to surgeons, trying to make their lives easier and get better outcomes. So what kind of medical sales are there? There's all types. There's ventilators, beds, cautery, power equipment, the big surgical lights, things as easy as gloves, operating tools, and then orthopedics, plastics. I mean, there's tons and tons of disciplines there. Each different type of sales has varying involvement. If you're talking about gloves, you just get them fitted, show them maybe a new type of latex or if they're textured, and that's pretty much as involved as it gets. If you move something to more like myself, you're in there pointing out different diameters of drill bits and screws and how to assemble a knee. So there's a lot more involvement there. And generally, there's about one orthopedic rep per big hospital. I obviously cover a few smaller ones, so I have a bigger area. But someone like I said, the glove rep guy, he would cover all Alberta because low complexity equals a larger territory. And then you would work with your company to figure out the pay structure from there. Like I said before, just helping introduce new technologies to help patients and surgeons as well. Orthopedic sales, so high complexity, there's just instrumentation, the fixation methods are more complex, lots of different types of deformities or fractures you can run into. So case involvement is very high. What kind of orthopedics are we talking here? So for those that don't know, orthopedics is bone and joint, right? And the soft tissues involved. So muscle, tendons, ligaments. So in arthroplasty, think plastic. People say I have a plastic knee or a knee replacement. That's exactly what it is. So we cover hips, knees, shoulders. Other centers will do some elbow replacements or maybe some like thumb replacements and toe replacements of just the joints. Sports medicine, we do ACL reconstructions, rotator cuffs, ligament repairs of all types. Baseball players would be lots of elbow stuff maybe. There's meniscal repairs of the knee. And then for trauma, that's usually after hours or weekend stuff. So that's, grandma fell and broke her hip, or I've seen jockeys fall off the horse in a race and they hit the inner fence there. So you gotta put a big femoral or tibial nail down the shaft. You use screws in place to help fixation, or CMF, which is craniomaxillofacial. So someone gets, say, punched in the eye, there's ways to fix your bones in your face there as well. What kind of requirements are there? So generally is an aptitude for science and medicine. If you hated it, you probably wouldn't like it. You wouldn't be in there. Most of these jobs require a post-secondary degree of some sort, and they generally tend to err towards a Bachelor of Science of some sort. You need good people skills, which we'll get into later. Lots of critical thinking and problem solving. Not every knee is the same, not every hip is the same. And as good as these surgeons are with their training and their hands and everything, sometimes just poor bones, poor bone, and things fracture when they're not supposed to. And then we gotta, people turn and look at you like, what are we gonna do? What options do we have available? And then we just kind of get into a discussion with the surgeon and problem solve from there. Planning can make your life a lot easier as well. If you have enough tools to do 4 knees in a day, but there's 5 knees in 2 weeks, well, you got to bring in enough sets to do those procedures, right? And things are constantly changing, and so you got to make sure you're always planned well ahead. And articulate and precise communication. When these guys are operating and they ask you a question, they don't want a 3-minute blurb. They want like 2 sentences that'll give them the correct answer, yes or no, either way. Yeah. Where do I work? So the operating theaters of hospitals is primarily where I am, or where I like to be the most. That's kind of the fun part for me. I also deal with the processing department. So that is where they clean a lot of the medical instrumentation so that they can wrap it, put it in the autoclave that cooks it, and then it's all sterile and ready for use. I've at home, like today, I'll answer a lot of emails and self-education for myself. Sometimes surgeons will ask me to stop by their office just to show them some new instrumentation or go over some tough cases coming up. And then sometimes we'll travel for surgery courses as well. So we'll bring a couple surgeons to either to like Boston or to Calgary for cadaver course, or kind of whatever's being offered, wherever it is, we can go. What kind of duties do we have? Like I said, my favorite part is covering cases or surgeries, and we're just kind of like Google troubleshooting. So if there's any questions or issues, then that's when we're utilized the most. Otherwise, if things are going great, we really don't have many questions, which is really the best thing, right? Like I said, we help plan difficult cases. We got to balance our inventory. It's still a business that I deal with, so the company doesn't want to invest a ton of money having all this inventory on the shelf that's sterile, because the sterility expires, right? So they're trying to always balance their obsolescence of these sterile items. I have to understand the instrument use in and out, so I can describe it to a new nurse who's scrubbed for the first time, or walk a surgeon through a knee or a hip when they're just starting at a new hospital. I also liaise between surgeons, nurses, processors, and administrators. There's a lot of getting them to work together, understand why we need this new thing, or why we need to change what we're currently doing. And then just educate nurses, surgeons, myself. The better resource I am, the more comfortable I feel for any misadventure that may happen in there. We also do call for evenings and weekends. So if there's any questions, they're doing so like I said, grandma's hip, late Monday night, we might get a call with a couple questions, or they may ask us to come in, it happens occasionally, and it can disrupt some plans, but if they're asking you to come in, it's usually in the best interest of the patient for you to go, try and help them get the best result possible. And just emails. We're still dealing with the business, Zimmer Biomet, and we're trying to link that to what we run at the hospital. So it's a really intricate relationship that we try to maintain on both sides. This is a dislocated ankle. So I see this, and there may be some ligament repairs that are required. And then if you were to look at the x-ray, I'm sure there'd be some kind of distal lateral fibular fragment that's fractured and may need a repair, may heal on its own. But those are kinds of things I look at and I think are very interesting. Some people may be a little squeamish. On this next slide here, you'll see this wouldn't be fixation for this type of fracture or the fracture dislocation there, but this would be more for, more of a tibial fibular fracture. My journey. So I got honors in high school. I loved sports. I think school came pretty easy for me. Didn't need a lot of studying. I went to Capilano University in North Vancouver, where I proceeded to be on academic probation for 1 semester. So it can happen. As it turns out, you actually need to put a lot of work in post-secondary. It's not as easy as high school, and I learned the hard way. Then I went to University of Lethbridge for the neuroscience program. No idea what I wanted to do. I just thought it was interesting. And then I worked all through school and did a lot of bartending, which I believe helped me a lot with my personal skills, got to strike up conversations with strangers, and just be friendly and happy, right? Then I went on to work at the Canadian Center for the Behavioral Neuroscience, with the CCBN at the U of L. It was interesting. I got a couple credits for it, and I was considering a master's or PhD, but after about 2 years of doing it, research just wasn't for me. It was very interesting, but it was a lot more computer work and writing papers than I would like to do. So it was good for me to have that experience to realize, what's not for me. After that, I kind of loosely considered optometry or chiropractic school, but then I really wanted to take some time off, and then this job came up. So I put my name in the hat, went for 5 interviews at the age of 22, 2 in Vancouver and 2 in Toronto as well. So they wanted to really make sure, and then I got the job, and I really liked it. It was good money, and it was really interesting for me. And then while doing this job, I ended up trying to write the MCAT a couple times to become a doctor, and I applied with no avail in Canada, and then I applied to Australia, got in, and after weighing the pros and cons, and there's a lot of intricacies in applying overseas and trying to get back, I decided to defer, but don't regret it. I really happy with my job and I enjoy it. It's just tough decision at the time, and the one piece of advice I would love to pass on to anyone is keep all the doors open. So post-secondary is a relatively short period of time in your life. Just do it good. Just get the best marks you can. If you're uncertain, just keep the doors open. Taking the hardest classes don't necessarily get you further in life at the end, where a higher GPA would. Lots of things to think about. Training for the job. So I got my BSc in neuroscience. I was thrown to a crash course for 3 weeks, which kind of prepared me, I guess. But really it was the in-case training and the learning with another rep. Lots of questions to surgeons who were great to me. They really helped me come up to where I am now. Discussions with peers and lots of self-learning. So the amount of reading I did in the first 2 years was astronomical, more than I did in university. So surgical techniques, brochures, medical papers, didactic courses, cadaver courses, and I just play with instrumentation nonstop to learn it in and out. For those of you that don't know what these people are, they're old people. So these are the people that are getting hips and knees now, and these are people that surgeons use our product in, and that's how I make a living. So I'll show you a couple of pictures of hip and knees here. So these are generally what they look like on X-ray, but you can see all these images I chose, they actually went in to get revised or changed out because they either fitted incorrectly or the patients had some difficulties and fell or fractured the pieces around them and required a new piece to get put in. I'm going to show you a couple videos here for a few minutes. They'll be a little graphic, but they are with cadavers, so there's not a ton of blood or anything. But I just think it's very interesting to see the amount of hammering and sawing. These guys are very good carpenters with medical training, obviously. But yeah, I'll just show you these for a few minutes.
Possible, but if you can't see what you're doing, then you run the risk of misaligning the component. So I think that's crucial. So you can see here, obvious medial compartment wear. There's some erosive changes in the tibial plateau. Also some erosion laterally, but more so medially, which accounts for the varus that we see on the x-ray. I like to just debride the lateral meniscus now so that I can
Take the proximal tibia resection. Remove the tibial assembly.
when I'm doing a balance technique, we're basically building everything off our tibial cut. So it's crucial that we get our tibial cut right. Slope, not as important as varus valgus, because minor differences in our slope will be accommodated for by femoral positioning when we balance the flexion gap. So I'll always visually check our varus valgus alignment before we go on to the next step. And this looks good. I'm going to leave my pins in just in case we have to resect more tibia, depending on what our extension gap thickness is.
Use the 8mm IM step drill to make a starter hole just above the insertion of the PCL. Insert the distal femoral cut guide assembly into the canal. Typically, the guide should be set for 5 degrees of valgus. After adjusting the cut guide for the desired depth of resection, insert 2 trocar-tipped pins through the standard pinholes marked 0. Then remove the IM rod assembly. Use an oscillating saw to resect the distal femur. Then remove the distal cut guide and pins. Place the leg in extension and insert a laminar spreader to expose the joint while removing any remaining osteophytes and meniscal remnants. Drill the peg holes for the patella. Insert the appropriate size and thickness tibial articular surface provisional component. Attach the patellar provisional and remove any overhanging lateral osteophytes from the perimeter of the patella. Perform a range of motion to check patellar tracking and ligament stability.
This is what I want to see is the patella tracks without any medial sutures. So we know that our femoral rotation is good. Our patella is tracking well. With a 10mm shim in, I've got about 2 millimeters of play in extension. And if I feel my collateral, it feels a little bit loose to me. I'm going to check my tension with the Cobb elevator, and I'm shooting for less than 1 millimeter. I can gap him open about 2 millimeters in flexion.
Then close the wound in the usual manner. Apply cement to the resected patellar surface and
So that was a knee procedure there, and that was not on a cadaver. But you could see some of the tools he was screwing on into place there. Those are all guides and jigs that are from my company, and we would coach the nurse how to hand it up to the surgeon and at what point in the surgery, and then the surgeon would also use it appropriately. And here is a few minutes for a hip
We're about
replacement.
to perform a total hip replacement for a patient with severe osteoarthritis of the hip. Ventilate any of our breath
of an infection can be devastating.
and replace just that component. Is that if one component of the total hip system begins to wear out or fail, you can actually go in and replace just that component without having to redo everything. These operations are actually rehearsed now on digital x-rays before we ever get to the operating room. So we have a rough idea about what size implants we're going to be using.
So we are opening now.
Today we're using a posterior lateral approach, probably one of the most common approaches that you'll see with total hip replacements. We've successfully dislocated the hip and removed the femoral head or ball to the ball and hip socket.
So here's some cartilage here, but there's no cartilage there. That's basically raw bone. And he's been walking on a surface of just raw bone there, and that's very uncomfortable.
Bones are, as you know, very rigid tissues, so we have to utilize mechanical tools to prepare them properly to receive the implant. With respect to hip replacements, the materials have improved significantly in the last decade, and those have benefited patients by having longer lasting hips than ever before.
So this is our size that we templated of 4. We'll see how that fits. There's lots of cartilage in the hip socket. So what has remained of the hip socket we'll smooth. We have a trial femoral component in place. We have the real socket piece in place. We're going to check its position.
At this point in the case, we bring in an x-ray unit to just verify that the implant is appropriately placed.
Okay, I think we look good. I think
We want it tight enough that the patient can walk on it, but not too tight such that when we place the real implant, we could potentially sustain a fracture.
so. What we're trying to do is make sure we're good and stable, that the hip can go into all kinds of crazy positions without dislocating. That's really good. That's awesome. You don't get any better than that.
As we're closing the wound, we want to make sure that we irrigate all aspects of the wound real carefully. That way we are able to flush out any bacteria that might have gotten into the wound during the case, even despite our meticulous move the patient over to the recovery room.
Alrighty, so that was videos on hip and knee replacements. So again, all those pieces there are hammering in there and washing with. A lot of those are either my company or some other company, and that's kind of where everything in that video comes from, some company, right? And that company hires salesmen to show their product, right? So what kind of rewards do I feel like I get from this job? I feel like I'm helping people get the best implant devices possible. So you know, if it was my grandma on the table, I'd be very happy knowing I'm doing everything I can to get the best best hip or knee possible. I'm also helping the surgeons get make them feel as comfortable as possible with the best technology or the best technique tips here and there. Nurses, just helping everyone towards the same goal. I guess I get to work with very brilliant people, surgeons and nurses and administrators and processors as well. And we all are working towards the same goal of just helping people improve their lives. And it can be a good environment, There's lots of good people there. Sometimes there's music playing, good conversations. Other times it's a little more challenging. Things maybe have taken a little bit of a turn, so we have to get back on track, and that can, involve some more thinking. But it's all part of the process. So some of the challenges, no matter how much you prepare, sometimes isn't enough, and you'll dumb. You'll get a couple questions here and there that feel like they're out of the blue, and never try to make anything up. These are smart people, and there's no shame in telling someone, I don't know, but I'll find out for you right away. It's not hard to take a couple minutes and make a phone call or an email for later that night, or pull up surgical techniques. But problems can arise if you just try to make something up, right? Weekend and evening call can be challenging. It can add on a couple of evenings and weekends or weekend days a week in extra work. But like I said, if they're asking you to come in, hey man, it's part of the job. It's part of what I signed up for, and it's really for the best for the patient. Travel can be tough. I drive to Medicine Hat a couple of times a week, so I'm up at 5:30 hitting the road. Tough questions that require a lot of digging and reading papers sometimes. Like I discussed earlier, the stigma of a salesman was tough for me to overcome. And then, like I said before, I'm just doing the job for the company of new technology, and hey, new technology helps everyone. So I'm just trying to get everyone to work together, and happily. Can be a challenge sometimes. A lot of personalities in there, but it's my job to be the grease in the gears and help everything run smoothly. There's some concerns with the job. There's concerns with every job as far as longevity goes, but these are just some within the medical sales industry that I've encountered or had concerns with. So lots of AHS, Alberta Health Services, is the big governing body for Alberta in regards to healthcare. And so every couple of years, they have a contract for arthroplasty or for hips and knee replacements. And they'll say, if you guys want to have some exclusivity with us, be one of 3 companies, then you have to reduce your prices. If I was that company, if I was AHS, I'd be doing the same thing. But what happens is the less margin the company makes, well, the company has to make up for that somehow, right? So it's either by getting way more volume through that you sell more at a cheaper price, right? Or if it's a tough year like it was last year with COVID-19 and they had to pause a lot of surgeries, then they can do things to reduce salary, bonuses, commissions, whatever it is, because they have a bottom line they have to meet too, right? And they need enough money to buy new instrumentation for the next year for other hospitals that are waiting, or to drive new technology and new interest. Another thing is, as raw materials go up, so when Donald Trump introduced the tariffs on steel and other commodities, that reduces margins. It's more expensive to get these metal pieces made. Or as a Canadian dollar goes down, well, in Canada, we buy our instrumentation from the States. So as our dollar goes down, those sets cost more. There's new kind of structures for reps as per our GM, not ours in particular, but other companies, more feet on the street. So by having more people out there paid less, it gives you more exposure to more surgeons and hospitals and stuff. In the US, there's some different pricing models where they say, okay, the price for a knee is $1,000 with a rep, and without a rep, it is $800. So the hospital can save some money, and I understand they won't have a rep to watch their implants, handle expiries, troubleshoot for them, all these types of things. Some hospitals will make their own ortho specialist. There's competition between other companies. We're business, and I'd say it's not too cutthroat. It's not like Love and Other Drugs, the pharmaceutical rep movie, but it happens. People change their minds or want to try new products, and you just hope it's you. And then there's recalls, which are very out of your hands. So whether it's a sterility issue, or if an implant after 5 years just wasn't having good results, they may take it off the market, and that can negatively impact me as well. Salary and benefits. So structures vary between company and company, from whether it's glove sales, orthopedic sales, all these different sales types. You can be contracted directly from Zimmer Biomet, or so you can be a direct employee at Zimmer Biomet. So I would answer to them, they would pay me. I'm underneath their umbrella. Or as in my case, I'm actually my own company. I'm incorporated, which allows me to do some write-offs for my company. But then Zimmer contracts me out to sell their devices. Just a different model, different way to have it. Companies can do salary, straight salary, a salary plus a bonus if you sell X amount for that year. And then there's also pure commission, right? So if you get a bunch of new stuff in the hospital and they're using it all, you can make a lot of money. On the flip side, if there's a recall, or if they don't like your product anymore, something new replaces it, well then guess what? You're eating Kraft dinner for a couple months. Starting wage, I think it's usually around 50 or 70,000. They start you off pretty low just to understand where you stand. Is it something for you? Are you going to succeed? Are you the hire they're hoping to get? And the high end, once guys are a little more established, and depending on the complexity of your sales and how successful you are, it can be 100,000, it could be 200,000 or higher. I mean, I've heard of some people selling beds of all things, and if it's a good year, like 400,000. But then maybe the next year, well, guess what? Everyone has a bed already, so maybe it's only 50. It can be a lot of fluctuation there. Benefits, I don't get benefits, but they have put a plan out for us with Manulife that if we want to buy into, we can. So I've done that. No pension. And once again, these could be company specific, so other companies may offer it, but I also have no pension. So that's something I have to know and save for starting now. Holidays, I try to get 2 or 3 weeks in. I don't always get it. I'm given a lot of autonomy with my job, which is nice, but it's also makes you feel very involved and hard to get away. My work hours, so elective surgeries are between 7:30 and 3, at least in my area. So that's stuff that's planned. And then there's also the trauma call that evening or on the weekends. And sometimes, if there's only one need booked, well, then I might be done at 10:30. Other times, maybe it's a full day and then they have booked 3 cases for that night. So I'll work from 7:30 till, 10:30 at night. So there's some really long days, some really short days. like I say, just take it when you can get it. If I'm done at 10:30 and want to go to the gym or go golfing, I'm going to enjoy it because I may not see that for a couple of weeks, right? Yeah. Educational requirements. Like I said, usually post-secondary is required. Some companies really want a sales history with their applicants. I didn't really have one. Headhunting companies, these are companies that aid in finding new jobs and positions. They can be helpful in finding any kind of medical sales or any other kind of job you're interested in. Some companies will also issue personality tests to see how aggressive of a salesman you are. I don't know if that's necessary, but I think it is interesting to do personality tests to figure out, who you are as a person. How do you best interact with people, and how do you understand what different personalities are saying to you? And there's lots of different professions that have turned into orthopedic sales. So chiropractors, physios, teachers, like I said, a whole whack of different positions that have converted into medical sales. And I'm sure there's also been a whole bunch of them that have converted out. But it is a very interesting job that I enjoyed. So what kind of opportunities are there within the organization? Like I said, it's kind of a tough job to get. It's not really publicized when they're searching. Headhunting companies can kind of dig them out, or word of mouth is usually a very common way as well. Yeah, between different medical sales jobs, some are more cold call, so you have to go office to office and make your pitch. And mine is every day I just try to show up and be helpful. And when we have something new, I'll show it, but you don't want to overwhelm these guys that you kind of make good relationships with and see them all the time. Kind of advancements are there in my industry. With my personal position, there's not a lot of advancement unless I want to move away. Because I am a rural person, I can't be in corporate. That's in Vancouver or Toronto. And being in the corporate office would require a lot more spreadsheets and planning and budgeting, all those kinds of things, and not case coverage where you're in with the surgeries. And that's the part I really enjoy. But if you stay on with the company long enough, you can get increase in commissions. You can obviously increase your sales at your hospital. The longer you're with the company, probably the better you are. So should get an increase in pay that way. So kind of within my job, you can go salesman, you can be a regional supervisor, which I do have in Calgary, and he just kind of helps funnel what's necessary to our distributor or our boss for Western Canada. So that's all without going the corporate route. And like I said before, there's lots of autonomy with my job. I'm my own boss in this region, so I kind of handle the what I want to show the surgeons, what I want to focus on, how I want to teach the nurses, and all these kinds of things. I handle that the way I want to, which is nice. But there is also a lot on your shoulders, right? It makes you feel very responsible for what goes in, and if there's any issues, to try and solve them. Work-life balance. So I put into pros and cons. Pro, I'm generally home every night. So that's nice. I get to sleep in my own bed. Con, there can be really long days with anticipated hours. So, if there's a hip that goes wrong at the end of the day, or if you're there and they ask for your help for a proximal tibial fracture, you stick around to offer a hand, but that can make for some pretty long hours sometimes. Pro, the autonomy. Pro, travel for courses, which if it's so many courses in a short period of time, it feels like a con, but education is always, I always welcome it, and it's always very helpful for your job. Pro, yeah, it's good money and provides a good lifestyle as long as you can keep it balanced. Pro, interesting. I really like it. It's very mentally stimulating. Read lots of medical journals and techniques just to keep up with my skills and be as helpful and relevant as I can in the room. Just to be a good resource, be useful, right? Pro or con, like I said, lots of reading and learning. Some may see that as a con. And the other con, which I went over before, is the call. I don't know how many concerts I've had to cancel or hockey games I've had to miss, all because I was stuck in the operating room. But that's just part of the job. That is it. Hopefully it all kind of made sense. And Kevin?
Yeah, that's awesome. You've described to me before what you do, but now that I've seen the detail, it astounds me that you're not a doctor, but yet it's like you kind of have that presence, I guess, in a sense, because you're right in there. You're advising and helping the surgeons and the surgical team. It's amazing. And I guess and you forget to think about it too sometimes, about, you said medical sales in general, like from rubber gloves to beds to all that medical equipment. Somebody sells that to the hospitals and to the surgeons, and you never really think of that's a whole field of, and that's just in healthcare. I mean, you think of all the other avenues there where there's salespeople involved, and the fact that you can kind of combine that science with that sales, I don't know. I just don't know if you have any questions. I'm just intrigued. I'm intrigued that with a 4-year science degree too, that you're able to do those kinds of things.
Took a lot of reading, and the companies are good too. They provide a lot of educational courses. Obviously not now, but they would fly you in to do some kind of hip course or cadaver courses, and when you go with surgeons to like anterior hip courses or whatever kind of new technology, you're in there like a dirty shirt. You're trying to, or I am, I'm trying to understand as much as I can about the new procedure, and the docs know that the more we understand, the more we feel comfortable with the procedure, the more enlightened we are, and we can provide some better insight to if they run into issues or things like that.
I know in my years as a career counselor, I've often had students shy away from medicine, and it kind of frustrates me sometimes, because I think some of them would make good doctors or surgeons or specialists of some sort, but I think so many of them shy away from that 10, 11, 13, 14 year training period, and yet for some of those, and I hope that we don't have everybody shy away for that reason. We need those people, but I mean, there is, again, what you kind of are showing us, that there's another, use your intelligence and little less training, you can still kind of get some pretty highly scientific hands-on work in kind of related to medicine, and I think that's I think that's going to be good for people that see this, that they might go, though like you say, these jobs aren't a dime a dozen, but there's an avenue out there. There's another avenue. And this is not just a joke around, but I know you've gone over to Europe with that team of doctors before to play hockey. Is that kind of a spin-off thing from working with these guys? Is that how that happened?
Yeah. So when I first started 10 years ago, met this guy who he just started at Lethbridge Hospital as an orthopedic surgeon, and we started playing hockey together. And his buddies that he went to med school with, they all had this hockey team that they would all always do these regional hockey tournaments in Red Deer or Vernon, and they canceled one of them. And so he was telling me, oh, we're planning to go to Europe next year. And I'm like, yeah, that sounds awesome. And he's like, well, hey, you're pretty good. Like, you want to come with? Absolutely. So that was 10 years ago, and we've been to Europe 8 times. We picked 2 or 3 different countries and just play local. It's like a glorified beer league. We go over there and play international beer league, and play some pro teams depending on the countries you're at, and it's blast. But yeah, that's definitely a relationship and an opportunity. That really only came about through the contacts I made with my job, and very unique. Sometimes
that spin-off stuff. I also, like you mentioned a while earlier on, about that you worked as a bartender while you're going to university, and how you thought that some of those skills have come in pretty handy. And I think sometimes too, we forget about some of those jobs that we have as high school students or as college students, that, some people look at them as just that's just the dead end thing, that it's giving me some cash. But they also, those soft skills that a person learns sometimes or develops in those things, that come in handy when you get to the line of work that you're maybe more going to use as a career type occupation.
Totally. I mean, lots of servers and bartenders as well. I mean, same idea. We are socially, you meet a new table and you got to make friends right away. Yeah. And if you have a tough personality at the table, you just got to keep your cool and answer their questions and get them their food. And in the OR, I mean, there's some stressful times, right, where things drop or get broken, and they look at me with these big eyes, and there's like a lot of nurses, what do we do now? Because they look at me, what instrumentation do I have to fix this problem and how do we use it? So it's just for me to provide a cool atmosphere and come up with some kind of solution with what I know is available.
Yeah, so I mean, some of those jobs, there's more to them than what it appears at times, I think. Yeah.
Oh,
Anyways, Cam, I don't have anything else. Once again, I'm intrigued by what you do, and I always have been. And this is again, I'm learning lots from people here. Now I have a better insight of what you do. And I've always respected you, but now you might be the guy that's replacing my hip someday. Though I'm from Saskatchewan, so probably not. So I probably okay. But
I know some of those guys. I know there's some good guys there. You know, they could hook you up.
Yeah, when you showed the Woodstock people there, yeah, I'm getting close to that age range. So yeah, we're I'll be the next generation of hip replacements and knee replacements. So we're gonna need guys like you. So again, thanks a lot. Appreciate it.